Coming from a clinical perspective, and during that time, being a specialist in that field, I'm sure you're coming across a number of cases of patients who are actually having COVID. From your experience, what was the time frame between an active infection and a death that you saw that actually spooked you at that time?
I tell you, every COVID case spooked me because for me, most of the cases that I used to treat were intensive care, intensive care, high dependency, so more or less critical care, so to speak. And I can say we could probably, if a patient walked in into ICU, and I'll be very specific, if a patient came to HDO ICU, more often than not, because I think for us, from my own estimates, our case fatality ratio was just about 13 to 15%, which is still
Slightly high.
quite high, yeah, because most of those patients were very sick. And at that time, most of those medications were not readily available. So for us, we were literally learning as we moved because things were not clear at all. But as we started moving, it started becoming clear that there were other supportive things that we needed to do for these patients, because these patients were clotting a lot. So they were clotting, they were literally clotting in every single blood vessel. So you needed to control some of those. Some of those drugs are not cheap.
Yeah.
So in addition to giving you dexamethasone, there are these other additional things that you have to give in addition to the oxygen. So it was a very chaotic way of managing patients. So you find even the guidelines were changing.
Yeah.
As we kept moving. But by and large, by the time patients would come, some patients will die probably even in day 3 of admission. So the timing really differed. Some would 3 days, others 14 days. But at least the majority will try to get them out of it.